Hi, Dr. Chuck here. I'm Dr. Charles Meakin from coachitforwardchuck.com. That's my website. After 30 years of working hard as a cancer doctor, I've transferred over to a health and wellness coach and have created a website where I can share a lot of important resources from 30 years of health and wellness work and oncology work, as well as we have other coaches there, and this is a charity website. So if one would like to be coached, we have an opportunity for that. And if they're pleased with the results, they pay it forward by donating to the charities that we have listed there. These are all charities that are near and dear to me that I think are important and also very lean. And we have about 6 coaches there as well. And we hope to have more over the future to kind of get this pay it forward movement going, as well as people might start coaching and realize that it's good for them and helps them make some transformations. Today I'd like to talk about a tool that I've had in my toolbox for the last few years as a cancer doc. I kind of stumbled upon it, and it's a funny story. It's called Oxygen Plus. And I use a lot of oxygen therapies. I'm a biohacker and do breathing strategies, do hyperbaric oxygen chambers, and also ozone type treatments and stuff. But this fits my theme of simple, affordable, accessible health products that when you do, it gets 80% of the results done, the Pareto principle. So I got to tell you the story of how I found this product. I was at a medical meeting, actually a hospital governance meeting in Naples, and I met this lovely lady, Christine. Christine was telling me about her life. She had worked as a social worker. After a while, I mentioned that, I'm here for a medical convention, and confessed that I am a physician. So she said, well, ironically, I'm kind of gotten into the medical equipment business. I, as a social worker, saw so many people that couldn't qualify for oxygen and were very limited. And I just thought to myself, golly, can't we put oxygen in a can and help people get it in a portable way for just those boosts between their kind of, their activities? And so this clever and resourceful gal got to work. She borrowed some money, created the company Oxygen Plus, and I love hearing stories like that, because when products are created from a source of love or from a source of pain, they usually result in very authentic products with a great history and great growth, and this certainly is one of them. So, I then got to know Christine and her family, and they were kind enough to send some of this down to the cancer center where I was working, because I had plenty of people that had cardiovascular issues or lung issues that made them really struggle, but they didn't have below a oxygen saturation of 80% on room air, which got them the coverage for the home oxygen. In addition, some of them didn't want to carry the condenser around, even though they've gotten smaller. So I gave people samples, and there's smaller versions of this. This is the biggest one. There's kind of a medium size and a very small one you could put in a coat pocket. And what they would do, and many of the patients, like on hot days or muggy days or humid days, say they're going out for a grocery run or to the mall or to see family, and they were a little unsure of their stability, they would oxygen up and 3 or 5 breaths and would get them going, and they could feel immediately benefits from that. In fact, at work I would frequently put my O2 saturation tool on and see where they were without it, and then give them 5 breaths and see it go up a bit like you would if you put a mask on. And it really helped them. It was short term, but it gave them the flexibility, and sometimes it just gave them the confidence to get out and be more active and kind of be more independent. And that was so important. So I used it with my patient population, and then I started noticing it around. I've seen it at other places. It's actually a great tool for performance. It kind of talks about that on here. Those elite athletes who want to use it before a sprint or before a downhill ski or before whatever thing you're competing in. Ultimately, in all athletic events, production of ATP becomes a limiting factor. And one of the substrates going in the production of ATP is, oxidative metabolism. And if you run out of oxygen earlier, you're going to shut down earlier. So if you can get, maximum tissue oxygenation through 10 to 20 hits before you jump into the activity, it's only going to help. Other people use it, or students, or musicians. If they're going out to do a technical or high-intensity cognitive work, getting your brain oxygened up beforehand is definitely going to give you better results. We've shown this with people breathing fresh air. We usually quote percent of oxygen in air is 21%. But if you go out to a lot of our cities now, it's more like 17, 18%. If you get at high altitude, it goes down as well. If you get in a plane, which you can't take a canned oxygen in a plane, unfortunately, would be really where it's needed, you find that it goes down, the partial pressure oxygen goes down further. And people get relatively hypoxic. And that's a big part of altitude sickness, and people feeling some of it's effective jet lag some of it's time zone switch, but some of it's, cruising along at a low oxygen level for quite a while. Someone might benefit from using this after arrival at the airport or before departure. Once again, you can't take it on the plane. The company is really good about, if you're going somewhere at high altitude, they'll send a case of this, and it's reasonably, this is like $9 to $10. This has, I think, 150 breaths in it. It's quite a big supply, 180, so it's quite a big supply. There's also the use, some people use it when they're sick, like if they're overindulgence, like a hangover, or if they, fighting a cold or a flu. It just helps the body, with one of the fuels that it needs, and it can be very beneficial. So this is a tool in my box. I keep one of these I keep it in the car if I, feel a little sleepy, as I used to be when I was driving, and it's a great tool to have. So once again, Dr. Chuck, check out coachitforwardchuck.com. Remember, keep those health changes simple and accessible and affordable, and go for the main priorities, because that's where you're going to get the most results. And remember, you're your own best doctor, and stay strong and curious. Good luck.